An article this morning by Laura Hughes in the Financial Times highlights the profound challenges that any government faces in addressing the decay in the NHS. It's been known for some time, and Lord Darzi's report paints a grim picture of an underfunded, overstretched, outdated service that struggles to cope with demand and is exacerbated by both inefficiencies and the broader problem of integrating with community social care. For Keir Starmer, the problem is not just one of managing public expectations, but of setting achievable targets and working out when he's going to be judged. His emphasis on reform, moving to a digital service, shifting care to communities, focusing on prevention, sounds good politically, but overlooks the deeper systemic issues plaguing the NHS: bureaucratic inefficiencies, staff shortages, and equally the critical NHS decline as the workforce remains disengaged and overwhelmed by pressure, with significant portions of the budget still funneled towards hospital care, plugging the gaps rather than preventative community-based solutions. There is money, but a lot of it is going into the wrong places. A lot of it is going to prevent or to repair the damage caused by overlooking the system in the first place. First, you pay the bureaucrats, then you sort out the damage, then finally, if there's some money left, you pay your staff. That isn't the way to run a business. That is not the way to run a national health service. That is the way to run down a national health service. So first, you get rid of the unnecessary bureaucrats. And then you fix on a permanent basis the repairs. And then then you sort out your payment of staff, and you reverse the entire thing. So first you pay your staff, then you fix your hospital equipment and hospital buildings, and then you go for the bureaucrats. But probably you do all three at the same sort of time. And it's only going to be effective on that basis. Starmer's challenge lies in avoiding the trap of sound bites, and if he focuses on cosmetic reforms or ones that offer quick, visible results, he risks being judged in the long term as someone who has failed to address the underlying bureaucratic entanglements and the complex issue of attracting and retaining sufficient staff. The NHS, as Darzi underscores, requires not just more funding, but targeted investment in infrastructure, technology, and social care, areas where Labour's plans remain vague. The sound bites are great, but the actual plans are vague. And those plans could have been drawn up 10 years ago. This is a problem that has grown and grown and grown and was known long ago. And it's a problem which has partly been ushered in because of the complexity of different bureaucracies and the stubbornness of the bureaucratic management of the NHS to move forward. NHS England is a huge office full of people desperately firefighting, not firefighting for us, for the people, for the patients, but firefighting to stop the whistleblowers being heard. I promise you, there's probably more money going into fighting the whistleblowers than there is to dealing with repairing machinery, repairing scanners that can be used to help sort out cancer. More money is being pumped into lawyers' pockets than into repairing machinery which is broken. So patients have to go from one hospital to another, begging for a scan. And even when you get blood work done, you don't see the results. You don't hear the results. Oh, we'll only tell you if there's a problem. But actually, people have given up even saying that. Does it go slow? Because nobody really cares. Nobody takes responsibility. And in the end, nobody is personally accountable. Because you don't even have a GP anymore. You have a GP practice, which is a misnomer because it doesn't really practice anything except delay and evasion. And a sort of as sort of bullying, really. You're not allowed to criticise these things because we're working as hard as we can. Yeah, they are. Yeah, they are. But you never get to see the bureaucrats, do you? And the bureaucrats are the people who slow everything down. And they don't go on strike. Starmer will be judged by whether he can solve the core issues of the Darzi investigation that Darzi has identified, especially since public trust in the NHS is deeply tied to political success. A failure to deliver meaningful reform will be the condemnation of this government, much as previous ones have been condemned for their failure. And it's not enough just to stand on your doorstep and clap. We've had enough of the clap.